Welcome back. Transforming healthcare in America. The future of Obamacare uncertain, but one issue affecting the sector right now, a nationwide shortage of doctors and nurses. One company looking to revolutionize on how hospitals hire healthcare professionals. Nomad Health is a startup which is taking the middleman out of the short-term healthcare staffing equation. Co-founder and CEO Nomad Health, Alexi Nazem, is with us right now. He joins us to talk more about it. Alexi, good to see you.
Great to see you.
Thanks so much for joining us. So first, characterize the situation for us. I just mentioned during the commercial break, every month when we do the jobs numbers, we always know that the jobs today are in healthcare because we need like 1 million new nurses in the next couple of years. How do you get one of those jobs? Tell us about Nomad.
Yeah, I mean, you're absolutely right. As you know, there is a huge shortage of doctors, a huge shortage of nurses across the country. Hospitals, clinics, every healthcare organization is just struggling to hire enough doctors, nurses, and other clinicians to care for this exploding number of patients. And Nomad is a technology solution to cut through all of that red tape, make it simple to do malpractice insurance, credentialing, background checking, so that we can get doctors and hospitals together, solve some of these shortage problems.
You've compared it to the Airbnb system.
Yeah. What we want to do is to bring that convenience that we're so accustomed to in all the rest of our lives, the convenience of Airbnb, the convenience of summoning an Uber from your phone. We want to bring that, we are bringing that level of convenience to healthcare with Nomad.
We've seen over the years, especially in areas where the legal malpractice system is particularly hostile to the practice of medicine. Rural areas may not have an OB/GYN all the time. Is this a solution to these kind of shortages? Maybe people could be moving around temporarily at different spots?
Yeah, that's exactly what this is. So this is the gig economy for healthcare. There are lots of doctors who want to do extra work around the country. There's a lot of latent capacity in the system, but it's so challenging to get, find those jobs and move around. And so Nomad makes it really easy to do that. So you can, quickly and cheaply fill those positions, that OB/GYN in a rural area.
But if there's such a shortage, how would it be cheap? Because no decent OB/GYN would move to a rural area. That's the problem, because they just won't get it paid as much as they would even in a suburban or particularly large urban area.
So the solution to the healthcare shortage, the clinician shortage, is multifold. This is one part of that solution, which is making the liquidity of the workforce higher, making it easier for those doctors who do want to work around, who do want to move around, who do have that extra time and the interest to go help out, even for a week, a month, in a particular area. So reducing those barriers, making it simpler for doctors to move around, is what we're working on.
So what are the barriers to getting a job through Nomad? I mean, obviously you need a certain skill set to...
Yeah, so I'm a doctor myself. I tried to do this kind of temporary work and I want to help out with the shortage. It took me 10 months to organize a 3-day job, and it's because it's all, you got to go through brokers. There's hundreds of pages of paperwork you've got to fill out. You got to deal with, people on the phone and fax machines. I mean, literally people are still using fax machines.
Right.
And so what we've tried to do is eliminate a lot of that complexity and use modern technology to move things along much more quickly. And that makes a big difference.
And I know this from personal experience growing up in a very small town. What you are seeing, though, which is doing some of what you're doing with Nomad, is you have these healthcare collectives where you will have a hospital system buys up all of these smaller practices across an entire area so they can move doctors around them. Now, that's a very regional phenomenon, I would guess, but couldn't that go basically nationally?
Well, you are seeing a lot of consolidation in healthcare, partially for that reason, because you can introduce a lot of efficiencies with the workforce, among many other things, when you link multiple hospitals and clinics together. So we're seeing a lot more of that across the country now.
How is our current healthcare situation going on with our government impacting your endeavors and impacting doctors and nurses in general?
Yeah, I mean, it's a challenging situation. I don't know how much we have, like an hour to talk about it. Yeah, I mean, but all joking aside, I think that what we're talking about, some of the quick fixes that are on the table today are not going to be the solution. This is a really complicated question. I can't talk about the politics. I'm not qualified. I'm just a doctor. But
what do you see?
But what I see is that what we want to do is, what I'd love to see as a physician is for every person in America to have insurance, so that everyone's invested in health. We can then put that issue to bed and then focus on innovation, technology solutions, reducing the cost of care, improving the quality of care. Those are the things that we all actually care about.
You've also gotten into the telemedicine market.
Yeah,
So
that's super exciting. Really, what Nomad is the single destination for all types of jobs. Doctors want to answer that call, help patients across the country, and this is a really growing way of doing that, a kind of a return to the roots of medicine where doctors can see patients in their home, although now with the convenience of technology with the phone. And so what we are now doing is putting doctors into those kind of telemedicine jobs through Nomad.
Really interesting stuff. Alexi, thank you.
Thank you so much. It's a pleasure to be here.
Alexi Nazem joining us there.